Hi, my name is Melanie Moore. I'm a senior athletic training student here at Florida Gulf Coast University. Today I will be performing the assessment of an SCAT5. So basically what this is, it's a standardized tool for evaluating concussions designed and used by physicians and licensed healthcare providers. So I think it's a great tool to have if you really suspect a concussion. It's very thorough, does take some time, but definitely one of the best forms of assessment out there for concussions. So to begin, I'm basically going to take you through each step, and that way you are able to identify the steps of SCAT5 and to also realize some red flags along the way. So that actually brings me to the first step. So when you're dealing with concussions, there are some red flags you definitely should be looking for, basically to identify that it's an urgent situation, and at that point, if any of these red flags occur, you definitely need to seek medical care right away. So basically, the red flags include neck pain or tenderness, double vision, weakness or tingling, burning in the arms or legs, severe or increasing headache, seizures or convulsions, loss of consciousness, deteriorating conscious athlete, vomiting, and increasing restlessness or agitation. So if you notice any of these red flags, once again, I think you can easily stop the SCAT because that could signify an emergency situation going on, and therefore address and go through your emergency protocol. So the next step is observable signs. So basically, this is what you observe from the athlete, whether this is on video from exactly what happened, or the coach or another athlete identified what happened and can help you tell you what they saw. So if they noticed any lying motionless on the field, so basically that means they have no consciousness most of the time, just lying there, unable to get up or move. Their balance or gait difficulties, so if they get up and then all of a sudden you notice they start stumbling. Disorientation or confusion, so a lot of times when athletes get hit, even if they might not lose consciousness, they're very confused, not sure really where they are. A blank or vacant look, once again, not really sure what's going on, just kind of like, where am I type of feeling. And then of course facial injury after head trauma. So a lot of times with a head trauma you can have a facial injury, and that's something that you can probably usually easily identify by just observing. Step 3 is a memory assessment. So these are questions that you're going to ask your athlete basically to see if they can recall kind of what happened. These include, so I'm going to ask Asia today, which is my lovely demonstration of an athlete. I'm going to ask her a few questions, and these are simple yes or no questions. So, or yes or no as far as if she can identify and answer the question correctly. So this is a mock assessment, so we're not quite at a game, but I would ask a normal an athlete that's active, what venue are we at today?
Florida Gulf Coast University.
So we are at Florida Gulf Coast University. A lot of times it can be at a game, and hopefully you can identify which game they're at. Which half is it now? This really applies to the sport that you're dealing with, so this might not always be applicable to your situation, but you can ask what half it is now. Who scored last in the last match? So basically just trying to recall memory of what happened right before they got hit. What team did you play last week or game, and did your team win the last game? So now looking at short term and not quite long term, but at least regarding memory from the week before. So moving into step 4 is examination of the Glasgow Coma scale. Excuse me. So you always want to mark the time and date of the assessment when performing. So to begin, the best eye response. So you're looking for, at this point, the opening of the eye, if they are opening their eyes and they have pain, if they are opening their eyes to speech, if I'm saying, can you please open your eye, and they're able to do so, or if their eyes are opening spontaneously. So just looking for that eye involvement. Then you're moving on to verbal response. So sometimes athletes do go unconscious, but that is not required to make the diagnosis for a concussion. So another way to assess this is if they have a verbal response. You're looking for any type of sounds or inappropriate words, or confusion and disorientation, so at least hopefully they can respond if you're asking them a question and not just remain silent. So now you're looking for motor response. So you're also once again looking for no motor response at all to see if they're able to move their arms or legs, if they can extend to pain, abnormal flexion due to pain, flexion or withdrawal to pain, localized pain, and obeys commands, so that once again, can you move your arm? Are you able to feel your legs and whatnot? So these are all ranked 1 through 4. Moving on to the cervical spine assessment. So basically you want to ask yourself, does this athlete report that there's pain in the neck? And if so, is it pain-free at rest? So if there is no pain in the neck at rest, does this athlete have full range of active, pain-free range of motion? Once again, cervical assessment. So I would ask my athlete, can you please flex and extend and laterally bend your neck in both directions? And then, is the limb strength and sensation normal? So now this goes back to the healthcare provider to be able to identify if they feel that they have normal active range of motion. Okay. So now moving on to the off-field assessment. So you're always going to want to take the athlete's background, just so that way you can identify who you're, not just who you're performing the assessment on, but the school, age, and gender. Other things to note is their dominant hand, have they been diagnosed with a concussion previously, and if so, how many, and how recent that concussion was if they were diagnosed with one previously, and then how long did it take to recover. Unfortunately, if an athlete does return to play too soon with a concussion, there could be severe long-lasting damage. Therefore, that is why those questions are really important. So you also need to ask if the athlete has ever been injured in the head or been hospitalized for that injury, diagnosed or treated with a headache disorder or migraines, because if that's their only symptom, maybe they have a comorbidity going on and their headache might be from something else. Diagnosed with a learning disability or dyslexia. That way, if you're trying to identify symptoms or putting them through assessment, if something's not quite right, once again, it could be a signal of something else. Diagnosed with ADD or ADHD, diagnosed with depression, anxiety, or other psychiatric disorders, and always noting the date of birth, address, and information like that. The next step 2 of the off-field assessment would be symptom evaluation. This is extremely important because this is now telling you and identifying symptoms of the athlete, so truly getting an honest opinion of how they feel. So symptoms include being graded basically from none to mild, moderate to severe. So you're going to want to identify that and say, I'm going to ask you a series of questions if you have these symptoms, and if it's not at all, tell me, none. If it is, please rate it 1 through 6. So these symptoms include headache, a pressure in the head, neck pain, nausea or vomiting, dizziness, blurred vision, balance problems, sensitivity to light or noise, feeling slowed down, feeling in a fog, they just don't feel right, difficulty concentrating or remembering, fatigue or low energy, confusion, drowsiness, more emotional than usual, irritability, sadness, nervous, and this symptom's not quite always applicable to the situation, but sometimes trouble falling asleep at night. So this comes back that if an athlete came to you when you're doing this assessment maybe a few days after the concussion happened and they have had trouble falling asleep, this is something you're definitely going to want to ask them. Once you complete the symptoms of evaluation, you're going to want to total up all their symptoms. So once again, if this was a real life situation, I'd be asking Asia all these symptoms and she would once again rate them. So do you have any symptoms that I need to know about regarding to what I've just read off? Nope, so she is symptom free, which is a 0, which is great. Something else with symptoms is sometimes over time they can progressively get worse. So you're going to want to always check at a 5, 10, 15-minute intervals because they could get progressively worse as the concussion also progresses. Step 3 is a cognitive screening. So this I'm going to be interactive with Asia. So this is about the athlete's orientation. So you're going to ask questions like, what month is it? June. Going into knowing your athlete, so a lot of times athletic trainers have the ability to really know their athlete. Sometimes if you're at a high school level, you're dealing with a lot of athletes and it's hard to be able to keep track of knowing their personality, but sometimes, and just going through all cognitive screenings, just knowing your athlete, knowing what their normal is, and then maybe what's not so normal for them. So going on to the date today.
The 15th of June.
Correct, and the day of the week.
Friday.
And the year.
2017.
Great, and then approximately what time is it?
1:15.
Awesome. So once again, you'd also score that for orientation. It would be out of 5. So if they were not able to answer a question in a reasonable time frame, you would mark that as a 0. So immediate memory. So I'm just going to put her through 2 examples of this. So for immediate memory, you're going to give an athlete 5 words. You don't want them to assimilate in sounds, so that way they can at least distinguish them. And then you will ask them in the immediate time frame and then tell them to remember these words, because then you might ask them again later on, once again trying to identify when those symptoms appear. So the first 5 I'm going to give you is finger, penny, blanket, lemon, and insect. So can you repeat that for me?
Finger, penny, blanket, lemon, insect.
Wonderful. And then depending on your athlete, you can either have them do this multiple times, or once again, you always are going to want to go back and have that 1, 2, and 3 trials. That way you can really identify if they're having symptoms or not. If you fear your athlete is applicable, you can definitely add in 10 words, which would be like, I'll do an assessment real quick. So it would be finger, penny, blanket, lemon, insect, and then candle, paper, sugar, sandwich, wagon.
Oh god. Finger, penny, blanket, lemon, insect, wagon, sandwich.
Okay, so once again, knowing your athlete, I did say them very fast too, but so basically she scored the 7 out of 10 for that one. That would be trial 1, and then once again going back, having her memorize those words, and then going back. Okay, so concentration, this can be difficult for athletes without a concussion, very common. So I'm going to just start with the basic 3 numbers, and then she's going to repeat them back to me, but backwards. So I'm going to start just with 3, okay? 4, 9, 3.
3, 9, 4.
Good. And 6, 2, 9.
9, 2, 6.
Good. And then I'll just throw in one with 4. 3, 8, 1, 4.
4, 1, 8, 3.
Excellent. So her concentration as far as identifying digits backwards is excellent. So this one may once again be difficult for athletes to remember, but months in reverse order. So if you could just give me some of the months in reverse order.
December, November, October, September, August, July, June, May, April, March, February, January.
Excellent. So she was actually able to recall that reasonably fast, so that was excellent. Once again, knowing your athlete, if they are not able to repeat that back to you, it might not necessarily be a sign of a concussion, but maybe identifying at least the first 6. Neurological screening. So basically, can the patient read out loud? So this is basically just checking their neurological function of their brain. So what I'm going to have you do is, can you just read the bottom here for me?
Scoring on the SCAT5 should not be used as a standalone method to diagnose concussion.
That's good. Awesome. So she's able to read out loud. Does the patient have full range of motion of passive cervical spine movement? So we already did the active range of motion for cervical spine movement, and then I will quickly assess by passive. So go ahead and relax for me. So I'm going to go ahead and flex. Do you have any pain? And extend. And then laterally bend. And laterally bend to the right. So any pain with that? No. Wonderful. So she is pain-free with passive cervical spine movement. Without moving their head, can the patient look side to side, up and down without double vision? So are you able to look right and left and then up and down? Good, with no double vision. Can the patient perform finger to nose coordination test normally? So for this, I'm going to have her she's going to extend her arms and be able to touch her nose without moving. So can you go ahead and do that for me? And she is able to perform that test very gracefully. Next, can the patient perform tandem gait normally? So tandem gait is basically having no real step, just having a line step. So if you can go ahead and stand up for me. And then if you're not sure about your patient, you can always take a guard. It's better to be safe than sorry. Have one hand behind their back. That way if they fall, you can catch them. So go ahead. Good, good, good. She's able to walk with a tandem gait without an issue. So quickly moving on to balance examination, you're going to look at which foot is tested, if it's dominant or not, and testing it on a hard floor surface, and even the footwear. So I mean, if you're dealing with an athlete with cleats, it might be different than dealing with an athlete with ballet shoes. So the last assessment I'm going to take you through is step 5 of the off-field assessment, and this is delayed recall. So the delayed recall should be performed after 5 minutes of having elapsed since the end of the immediate recall session. So once again, going back to those 5 words, are you able to remember those 5 words I gave you a little bit ago?
Finger, penny, blanket, lemon, insect.
And she did that without a problem, so that's excellent. Once again, having 3 trials of that to make sure that they do not have delayed recall, and then you can hopefully make your decision on whether this athlete can return to play or if you are going to put them through the return to play protocol and go from there. One big thing I did want to say is scoring on the SCAT5 should be not used as a standalone method to diagnose a concussion. Cranial nerve assessment's a great assessment to also throw in there. And of course, maybe some impact testing, having a baseline impact test, and then also having them perform an impact test after their concussion if they're diagnosed with one. So thank you for watching.